I am Dr. Parijat Ram Tripathi, consultant pediatric gastroenterologist at Ankora Hospital in Hyderabad. So I will discuss about obesity in children. So obesity is a thing which we normally treat as a disease in children. What we say is if any small baby or a big boy is obese, like I'm not saying healthy, he's obese, we always find the child cute. So I feel that is a wrong thing. Obesity we need to identify as a problem to the child. It starts very early because obesity, so again I will say, most of the times it is because of the environmental factors, what diet we are giving, child is active or not, what kind of environment child is living in. Second thing is some diseases where child can become obese. Again, those diseases are rare. Most of the times as a parent, it is in our hand to prevent the obesity in your child. So to start with, when you have started feeding your child, develop good feeding habits. If you have to give very high fat, very high calories, that your doctor will tell if your child really needs it. Otherwise, when you are starting complementary feeds or when your child is growing in early toddler years like 2 year, 3 year, 4 year, you should give a balanced diet, which should be balanced in protein, carbohydrate, fat and fibers, so that your baby is just not eating fatty and sugary and carbohydrate filled diet all the time, because those are more tasty, they give more satiety to the child, and they are usually packaged in very we call it as very interesting manner. I will say that they always want to eat those things which are well packed, and mostly those contains high fat and high sugar or high carbohydrate. So what we need to do at the initial phases of life, develop a habit of giving them normal home cooked food, rarely junk, you should try to avoid, and then physical activity should be incorporated very early into the lifestyle of the child, so that a proper diet and proper daily activity should be the part of daily routine of the lifestyle of a child. Because what happens when these habits you inculcate in your child from the preschool time only, your child is very highly unlikely that he will become an obese in adolescence. What we are finding these days is children beyond 4 year, 5 year, 8 year, 10 year, we are finding obesity too frequently. So the diet and exercise is very important. As a parent, you should not push your child to eat too much. You should not be unnecessarily too much worried for the eating habits of your child if he is having normal weight. Sometimes what happens, child is gaining height, not gaining weight. He may be normal for his age, but you are feeling that your child is not healthy maybe, and you push too much of food that will lead to this obesity in the children. Then whatever habits you have started in, like if he is disturbing you too much, you make him or her sit in front of the TV and give some Maggie and other things, or any junk food you give, and over the time this will become his or her habit. So this you have to invest some time to not let these habits develop in your child. So the diet and exercise, these are the two most important things, because once obesity develops even in children, it will affect the liver of the child. It will affect the cardiovascular system of the child. Even we see in children there is fatty liver. They have a word what we called as non-alcoholic steatohepatitis. There is inflammation in the liver. That is a bad disease. Over 10 year, 15 year, it may damage liver very badly. Then there can be high blood pressure. We see even in children because of the obesity only. Then there are other disorders also. This gastroesophageal reflux disease is more in obese children. So a lot of diseases will develop because of the obesity. Then once such adolescent child is obese, there are very high chances that he will develop into an obese adult. Later he will develop diabetes early, cardiovascular problems early. So what we are sowing seeds, that is going to give fruits in the future. So two things most important: good habit like good dietary habit, good exercise, and third important thing is screen time. Control screen time as much as possible. No screen time below 2 years of age and limited screen time after that. Because of this lockdown, it is very difficult to stop the screen time completely. But other than the studies, at the time of eating, it should be restricted and it should be controlled, that it should not be excessive, and outdoor physical activity should be pushed too much. Because if we control obesity, you are going to make your child healthy for his whole life. A lot of diseases will not come to your child if he is not obese. So obesity and a lot of fat on the body should not be taken as a signal of the child being cute. It may be a disease. So you try to develop good dietary habit, good exercise, and decrease screen time. Thank you.